Hello, this is Dr. Michael Shear with LearnSATURNO, a free resource on how to market, treatment plan, place, and maintain SATURNO overdenture implants. The purpose of this video is to describe the surgical technique of placement of 4 SATURNO narrow diameter implants in the anterior mandible. We will be demonstrating placement of 4 2.9 by 12 millimeter SATURNO narrow diameter implants in the anterior mandible on this implant mandible replica. So, step 1 is as we describe the SATURNO implant itself, we see here it's a one-piece narrow diameter O-ball implant. This is a natural feeling for a lot of you O-ball O-ring users out there. You'll notice it's a one-piece implant, there's no two pieces. It's nice O-ring O-ball connection for simplicity purposes. The big difference here is that it utilizes the best of the Lodi implant overdenture system, the locator system, the thread portion as well as the proven RBM surface and the aggressive tapping apical nature of the Lodi implant, and it's being built into the O-ring O-ball SATURNO connection that Zest Anchors has designed. The SATURNO attachment and housing is revolutionary in the fact that it allows for a true pivoting capability of the O-ring assembly, which reduces the amount of wear to your O-ring assemblies. So I'm going to put our 2 implants to the side for a second to describe the surgical cassette as well as the technique. So first step is I want you to go ahead and take out your SATURNO technique manual for placement of these implants. And you'll notice here on the inside portion of the catalog or the manual, there's a description of the entire surgical system as well as the implant itself. We described a lot of these in details on the initial generic overdenture SATURNO video also on the YouTube channel. So we'll skip right here to the drill depth control as well as the drilling protocol for the SATURNO narrow diameter implant. You notice that each one of the drill stops that's included in the kit is functional for each one of the drills that's also in the kit. You'll see here that's a few different types of examples of either D1 or D2, D3, D4 bone and the drilling protocols as well. And in this case, we're not going to be using a 2.0 or a 2.4. We're going to be using the 2.9 millimeter drilling protocol using the drill stops. Now, very rarely do I recommend using the laser lines. I find the drill stops to be very easy as well as fast and efficient for your surgeries. So, step number 1 of our drilling protocol for our 2.9 millimeter SATURNO narrow diameter implant is we're going to be using the 1.2 millimeter pilot drill to full depth. And in this case, that's 12 millimeters. Now, not shown in our clinical example or benchtop example, this is a tissue punch. Because we're using a replica mandible that does not include any tissue, we're going to skip this step, but I'll show you how it works. Second drilling step is we're using a 1.6 millimeter drill to full depth, and then our final drill is a 2.1 to 8 millimeters deep, which corresponds 4 millimeters short. And then we can place our implants using our isolatch driver. All of the techniques are outlined in the further pages of the technique manual, and I'll be demonstrating them on our mandible replica. So, looking at our surgical cassette, as I've mentioned in earlier videos, you know that you have everything here that you would need to place the SATURNO narrow diameter implant, including all 4 of the drills, the drill stops, directional indicators, and our ratchet assemblies. We can put that aside for now because we'll be concentrating on some of the treatment planning aspect of the anterior mandible for SATURNO narrow diameter implants. So first and foremost is we have to describe all of our critical anatomy associated with implant placement in the anterior mandible. Now, I generally recommend using a cone beam CT to give a proper assessment of bone depth, height, and volume. However, you can use a panoramic radiograph or a periapical radiograph well controlled so that way you use that in conjunction with things like a bone sounding device or a caliper. Now, if you're going to use a panoramic radiograph, this bone caliper allows you to assess the the diameter of bone at certain positions of the mandible. In conjunction with our height measurements from the panoramic radiograph gives you a pretty good assessment of the bone volume. However, as I mentioned before, I really like cone beam CT because it gives us a really quality information. So first and foremost, we know that in the mandible we have our mental foramina, which are critical areas that we want to stay far away from. Now typically we want to recommend being approximately 5 millimeters anterior to that position and anterior to that position. And that allows us to correspond for a 2 millimeter safety zone plus the occasional or common anterior loop, which can run upwards of 3 millimeters. Now in this case, what I like to recommend is very similar to what we recommend with the Lodi surgical drilling protocol. First step is as we draw a midline marking. And that midline marking corresponds to the midline or symphysis of the mandible. Now at this point, we know that we need to be approximately, according to our technique manual, we need to be approximately 7 millimeters away from center to center between implants. And that helps us have room for both the SATURNO housing and acrylic resin to give it strength. So what I like to do is I like to take a bully gauge that's measured to 7 millimeters, and then I split the difference on the anterior ridge. And we know that we can do it this way, or we can simply just measure 3.5 millimeters each way to give us 7 millimeters. There you go. So that line right here is going to correspond to 7 millimeters between those two implants. And then we can very easily take our bully gauge again and measure 7 millimeters here, and then 7 millimeters here. Makes it very, very simple for us. And you can even sterilize this pencil and use it in surgical protocol if you decide to do a flap enlargement. Or you can plan this all out using guided surgery with the help of cone beam CT. So we can put our instruments aside, we can open up our surgical cassette and pull out our 1.2 millimeter pilot drill along with our 12 millimeter drill stop. With our 12 millimeter drill stop, it allows it to snap into place and then easily placed onto our surgical handpiece. Step 1 is at 800 to 1200 RPMs, we're going to drill a line corresponding to what I think is the long axis of all 4 of our implants right in the center. Just a gentle pumping up and down motion, stopping about halfway. And that's right on that center line. Why do I do that? I do that because I want to take my directional indicator and it allows me to verify that I have the proper long axis orientation of all 4 of my implants. Now the first thing that I'll notice is I want to change my angulation and just change it a little bit more to my patient's right side. And I can do that very easily, just like so, going a little bit deeper. And that allows me to get my proper angulation. Next step is as I take my 1.2 on a 12 millimeter drill stop and I line up according to where I'm going to bodily position my implant, using my drill stop as a guide, pumping up and down until I've reached my full implant osteotomy depth, pumping up and down and up and down. Also completing my final 2 on the side, using my implant and paralleling pin in the front as a guide. There we go. Cleaning off our mandible. We can then take the other directional indicators that are included in the kit to measure our parallelism between implants. And again, one thing you might have to do is remove the one from the center, just to give you a pretty good idea of how our implants are going to be positioned. Not too shabby. Now the next step is I'm going to put that back in the center and go on to our second drill, which is the 1.6 millimeter drill, also to full depth. So I'll pull out my 1.6 millimeter drill, and I'm going to swap out my 12 millimeter drill stop and remove my 1.2 millimeter drill, putting on my 1.6 millimeter drill into my handpiece with the corresponding depth indicator. Now, as I mentioned before, the rotary tissue punch is utilized in between the first 2 drills, and it is used just like so in flapless situations corresponding to your initial osteotomy hole, which is 1.2 millimeters wide, and also this guide pin on the rotary tissue punch will excise the tissue at 1.2 millimeters of osteotomy. So the first drill corresponds to the guide pin in the rotary tissue punch, making for a very easy surgical protocol. Next step is as I take my 1.6 millimeter drill the 1.6 millimeter drill at full osteotomy. And carrying on. And 1.6. And 1.6. Now, for our third drill, which also is our last drill, I can remove the 12 millimeter drill stop, putting it back in our cassette, and the 1.6 millimeter drill. I'm going to take out the 2.1 millimeter drill with the 8 millimeter drill stop. And the 8 millimeter drill stop corresponds to 4 millimeters short of my final implant position. And that creates a stepped osteotomy, so that way it allows for maximal apical grab when the implants are going into place. Also indicated on your directional indicators, you have a opposite side that allows for the 1.6 millimeter osteotomy double check, so the other side corresponds to my 1.6 millimeter osteotomies. I can remove that, put my center one back in, which has to be on the 1.2 millimeter side because I haven't prepared that any deeper or wider. I can take my final drill, which is the 2.1 to 8 millimeters, just like so, and like so, pumping up and down to get irrigation into the osteotomy, and completing my osteotomies like you see here, with a little bit of air, cleaning off. That's all of our completed osteotomies. Now we can go ahead and start getting set up for our implant placement, removing that device from our system. I can then take the ISO latch driver, which is specifically designed for placement of the straight SATURNO narrow diameter implants only. I'm going to place that onto my handpiece and change my settings over for implant insertion settings. Now I can open up my SATURNO box, and you see here I'm going to be placing a 2.9 by 12 millimeter implant with a 2 millimeter cuff height, at least for the anterior. I'll place 4 millimeter cuff heights for the posterior. Opening up my containers, as I carefully open, you'll notice here that I have a square driver, and you can insert this by hand or with the help of your ISO latch driver, which with the O-ring connection allows it to be very easily placed in the mandible with ease and precision. Now at this point I'm going to be placing my implant just like so until it just torques out. Right in here is where it's going to torque out. Now ideally this would be a little bit high for me to torque out. I would recommend removing this implant and enlarging the osteotomy either apically or widthwise. But since we're working on a styrofoam mandible, I know that it is going to be inserted, so I can then take my ratchet insert with my torque indicating ratchet plus my long driver. As I assemble all these together, the inside faces up. You'll hear a little snap, and the square driver gets inserted into my torque wrench, allowing me to take the tip off of the ISO latch driver from my handpiece and inserting the implant further, and allowing me to insert the implant further. Using the spring portion of the torque ratchet, it allows me to insert the implant fully until properly inserted, and that would be an example of properly inserted. Now just to simulate, I'll check the torque. Because it's on a styrofoam mandible, we won't get torque, but if I did it properly, you'd notice this would be reading about 30 Newton centimeters, which is appropriate indication for loading. So next step is we can go ahead and put one box aside, and we can open up our other box, which I'll have to open it up this way. Good. And this way. Good. Now as I open up our other implant, the packaging opens like so. The implant can be removed like that. If I wanted to insert by hand, I could do that, just using that tool And you'll see here it inserts pretty easily. And if I get to here, it feels pretty snug. I can then take my torque wrench, snapping it on, allowing me to insert. Now, one thing you have to notice is that as I bend, because it's an apically tapping implant, an aggressive tapping implant, I can change the angulation of this implant. I want to make sure that I keep that as straight as possible so that way I line up with all of the other implants. Now, the SATURNO housing allows for maximum versatility with angulation, still with given an opportunity to maintain a very straight implant, I'd prefer to do so. Just like so. Now, our last two implants, we're going to be placing 4mm cuff heights, as you see here. This is just to show us the second cuff height configuration available to SATURNO implant. As I take that, I will insert using my isolatch driver, grabbing the implant with the driver square head, and you'll see here how much taller the 4mm is. And completing my insertion using my driver. That stays there. And completing my insertion using the driver. Until I'm happy with my torque value. And all the assembly comes out, and I have my third implant properly placed. And now it's time for the last implant, which is also a 4mm cuff height. As I remove that and show you right here, again, same protocol. Taking my isolatch driver, connecting that part to the transfer, and inserting into my patient. Removing that portion from the isolatch driver, and then inserting it here. I can also insert without the use of the long driver. This is especially nice in situations where you don't want a lot of extra parts and pieces. That makes for easy insertion of the SATURNO implant. And now we've completed placement of our 4 SATURNO implants. As you see here, we have nice parallelism between our implants, proper spacing and protocol. And again, I've used the 4mm cuff height in the posterior and the 2mm cuff height in the anterior for demonstration purposes only. I don't recommend switching it up that much. I try to keep all 4 the same if possible. However, in some clinical situations, you might have to vary it. Now, also within each one of our SATURNO narrow diameter implant case boxes, there's going to be a housing as well as the little separator. And this is a little processing insert that sometimes you have to remove with like an Explorer. And that gets placed onto our SATURNO implant. And then our SATURNO housing gets placed on there just like so. And now it's ready to be picked up in our complete denture. So this has been the technique demonstration of placement of these 4 SATURNO narrow diameter implants. I've placed them in the anterior mandible 7mm apart from each other to allow for proper orientation of the housings of the SATURNO attachment. What's important here to make sure is that I treatment plan everything properly, make sure I have my space. If I wanted to, I could place it a little bit more distal to where my placement is right here, but that's only for advanced users that are comfortable with finding the mental foramen. Once I torque out at above 30 Newton centimeters for each one of these implants, I can connect it to my complete denture, completing the loading. So this is Dr. Michael Shear with LearnSATURNO, a free resource on how to market, treatment plan, place, and maintain SATURNO overdenture implants. Thank you, and stay tuned for other videos on the channel and other information related to the SATURNO narrow diameter implant system. Take care.